we think about where we were at the beginning of the pandemic, we didn't have enough PPE for healthcare workers. We didn't really know how to treat it, the low oxygen situation. And now we've come to a better place of treating it. Do you think that we are moving forward going to be better able to treat the really badly infected, the people who end up in intensive care, or even reduce the number of people who end up in intensive care before we even get a vaccine?
Yeah, let me kind of try and truncate that question into the high income countries. First of all, I think yes, we're going to only get better. We are continuing to see improvement in when you put people on mechanical ventilation, when you don't, how you monitor immunosuppression, whether that's a favorable or unfavorable approach. Any number of things like that we're doing a much better job with. And again, I salute the intensive care medicine doctors and nurses, support teams for what they've done. I mean, talk about being in a war. They've been there. Most people don't realize, but in the United States, over 1,000 healthcare workers have died from COVID-19 infection. Not all of those acquired on the job, but many were. And I can't say enough incredible compliments about what they've done. So I think we'll continue to see care get better. We have not yet had a knockout, oh my God, isn't that an amazing drug finding yet? We're still, remdesivir is at best marginally helpful, plasma marginally helpful, it looks like. Probably steroids may have more impact than any of those. And so we're still trying to do better there, but a lot of other parts of the medical approach have improved. What I worry about and continue to worry about is what we're seeing in so many countries of the world, where middle and low income countries, who will be the last to get vaccines, unfortunately, given I think the current scenario, are also the ones least capable of providing intensive care medicine. And so for the billions of people in those countries, the future outlook is not good. It's not good at all. And I think that's a challenge. We saw that in the Americas. If you look at what's happened in South America over the course of the last 10 weeks, it's been devastating, just devastating. And then the other thing that most people don't remember or talk about is collateral damage. As much as, everyone focused on Ebola in the DRC over the last couple of years, where we had an outbreak that was ongoing, of which several thousand cases, a number of deaths. What people don't realize, during that time, 3 times as many kids died from measles in those same areas because we couldn't deliver measles vaccine. And far outstripped Ebola, and yet nobody talked about that. We're beginning to see the collateral damage occur around the world of the lost opportunities for public health, for childhood immunizations, for maternal and child health, HIV/AIDS. I can go down the list, polio eradication. And so I think one of the yet unrecognized costs of this pandemic in terms of life and quality of life is well beyond that of just COVID-19 itself. It's also the issue of all the other public health challenges that are really in trouble right now.